Welcome to the Dr. Uprise series, Mips for Dummies. Government compliance with a Mips overview and a 2018 update will be covered in today's tutorial. The ever-changing world of government initiatives from PQRI to PQRS, meaningful use, and now Mips creates a complex web of regulations that is difficult to navigate. I hope we can dumb it down to a level even doctors can understand. Hello, I'm Kim Castleberry, and I've reviewed the latest iteration of Mips and think I've boiled it down for clinical consumption. I also think you'll find it's vital to have an EHR that respects clinical workflow and makes government compliance invisible to the physician. VisionWeb has allowed doctors to design an EHR that does just that. It makes Mips hands-free and invisible to your office. But first, why do Mips? There are plenty of good reasons to forego Mips, but today I want to focus on why you might want to be Mips compliant. Actions taken in 2018 will directly affect 2020 reimbursement, professional reputation, and practice value. It's clear after reviewing the latest Mips update, there are 5 main reasons to do Mips. Now, if I were David Letterman, I could probably find 10, but I'm not, and I couldn't, so here goes my top 5 countdown for the reasons to do Mips. Number 5, Medicare Part B reimbursement will adjust up or down plus or minus 9% in 2022. That's an 18% swing. Number 5, professional reputation. The Mips score will be posted on the CMS Physician Compare website. And number 3, practice value. Modification to future earnings will directly affect current practice value related to potential mergers and acquisitions. And number 2, provider compensation. Mips eligible clinicians will have a greater value to a practice based on the Mips score. And number 1, loan ratios. The ability to acquire and maintain a loan based on the debt service ratio coverage will make obtaining and financing loans easier and cheaper. The Quality Payment Program website contains good summary and detailed information straight from the horse's mouth. Although after reviewing, you may think it comes from the other end of the horse. Either way, you can find the government website information right here, and it's where I received and obtained most of the information that we present here today. Now, the cornerstone of the Mips are the 4 categories that make up our score: quality, improvement activities, advancing care, and cost. Now, the first 3 categories can be submitted for scoring by your EHR, and the final cost measure will be automatically calculated by CMS. Now, quality makes 50% of the score and contains measures for cataracts, glaucoma, diabetics, MACD-Gen, blood pressure, obesity, smoking, medication, and referrals, most of which we've been doing underneath PQRS and are not really new. Improvement activities is 15% of the score, and it is a new category that contains measures for patient surveys, referral communications, 24/7 access to EHR, care transitions communications, closing the referral loop, and patient portal use, most of which are new activities providers, and you're going to need a good EHR to comply. Advancing care information makes up 25% of our score, and it essentially replaces meaningful use. Now, these measures are things like security risk analysis, e-prescribing, summary of care info, providing patient electronic access to their records, patient portal, and secure messaging activities. And most of these are not new, but they do represent an increasing part of our grade. Now, finally, cost is 10% and will be calculated by CMS, so we don't need to do anything here. Let's look at the QPP highlights for 2018 compared to 2017. Now, the payment adjustment for 2020 is going to be up or down 5%. Additional bonus points will be available for exceptional performance, and scoring is going to be done on 0 to 100, just like school, and 15 points are all that's needed to avoid the penalty for 2020, and it's going to be very easy to do. 70 points are all that's needed for exceptional performance to get the 5+ points, and it's going to be easy to do with Uprise, and I think we're going to find it hard to do with most EHRs. Now, for 2018, if you do less than $90,000 or 200 patients, the providers are going to be exempt from MIPS. Now, these are small practices. Now, that's up from $30,000 and 100 patients for last year. If you want to find out how much you've done, just go to this link right here, put in your NPI number, and it'll tell you how much money you've done in Medicare and how many patients you've seen to see if you qualify or if you're exempt from MIPS. Now, quality is 50% of this score. That's down from 60%. Improvement activities are new at 15%. And advancing care is up at 25%. And cost is new at 10%. Now, there's going to be 5 bonus points for small practices for 2018. That's practices less than 15 doctors, and it's going to be added to the final score. The reporting periods have changed a bit. There's 12 months are going to be necessary for the quality and cost measures, up from 90 days. And the improvement activities, the new category, and the expanded advancing care category are going to be necessary to submit for only 90 days. Now, there's going to be an increased phased approach to QPP public reporting on the Physician Compare website for 2018. And there is disaster relief for 2017 hurricane victims. So if your practice was in the hurricane areas, you may qualify for MIPS release. Now, there are going to be hardship exemptions possible for small practices that have problems with advancing care. And there's additional detailed information from the American Optometric Association and the American Academy of Ophthalmology websites here. Most ECPs will be participating under the small practice guidelines. CMS defines small practices as less than 15 providers, and that will be our focus today. The 2018 MIPS update provides additional incentives to participate for small practices. The 2018 update allows 5 additional points to the final score for all small practices. 3 quality points if any category data is submitted but didn't meet the 60% data completeness threshold is available. Now, what does that mean? For instance, with primary open-angle glaucoma, you're supposed to submit 60% of all of your patients to meet the data threshold. If you don't submit 60% of all of your primary open-angle glaucoma, then you don't meet the data threshold, but you're still going to get 3 qualifying points. Now, there's going to be 10 advancing care points for using any certified EHR technology, 2014 or 2015 edition. There are going to be 5 additional advancing care points for 2015 edition certified EHR technology users. Now, small practices get to start with 5 bonus points to the total final score, and all you need is 15 points to avoid the 5% penalty for 2020. And with advancing care, there are exemptions for small practices. Now, let's see how we can come to grips with MIPS. Quality measures is the first category, and it's still the lion's share of your score. It's also the most complicated mess coming out of the south end of the horse, and I think I've boiled it down to just a few bullet points. Now, 60% of eligible instances for all patients need to be submitted for the data completeness threshold, or the denominators. Now, Uprise will measure all these instances automatically. They make up the denominator. Now, providing the care with Uprise will generate the numerators automatically. And the numerators and denominators are going to be measured against QPP benchmarks, which are other colleagues, for the points awarded for each measure. And each measure is going to have 3 to 10 points awarded and increasing as the numerator improves. Now, 3 points are going to be awarded for small practices, remember, if the 60% threshold is not met. Now, it means you're going to need a good automated MIPS to comply and to get a better score. Thank you. And the Uprise hands-free MIPS is an industry first, and it makes it easy to get a high grade. All you have to do is deliver the care. Now there's 6 measures that we can count for denominators, and it's all of our patients, and it's not just Medicare patients. So we pick 6 and do them on all of our patients, and they will count as the denominators. And these are things like glaucoma, diabetic care, MACD-Gen, blood pressure, BMI, tobacco, and medications. Now, improvement activities account for 15% of the score, and they represent practice improvement activities. And you have to do 1 high or 2 medium weighted activities for small practices, and these things are like improving patient access to your practice. It's also things like 24/7 clinician medical record access, and here fake cloud EHRs don't qualify. You have to be and have a true cloud EHR product, and Uprise is a true cloud-based product. And how do you know? You have to be able to access your EHR through any browser, anytime, anywhere, on any device. And if you have to use special software, special browsers, or VPNs to access your EHR, you have a fake cloud, and most EHRs today are actually fake cloud products simply running legacy software hosted in the cloud. So make sure you've got a true cloud product. And it's also care coordination documents or other patient improvement activities, and patient engagement activities like surveys, patient portals, and patient messaging, secure messaging. And again, Uprise provides automated support for improvement activities. Now, advancing care accounts for 25% of the score, and it represents activities from meaningful use. Now, these are not necessarily new activities, but they are a higher percentage of our score. And these are things like security risk analysis, e-prescribing, patient access, health information exchange activities, view, download, and transmit documents into the patient portal, patient-specific education, secure messaging, medication reconciliation, and Uprise provides support for advancing care. And again, we're going to have 2015 certification for the additional points pending in 2018. It's the second quarter. Now, cost is new for 2018, and it accounts for 10% of our score. And the Medicare spending per beneficiary formula will be used with a total per capita cost. Now, not to worry here, because CMS will calculate these scores, and they'll be available on the CMS website. And as soon as CMS makes them available to EHRs, we're going to have them posted into the score, the total score, inside of Uprise. Now that you understand MIPS basics, we can look at how Uprise can help. And VisionWeb has been hard at work since the release of the final rule, and I'm happy to announce another industry first, hands-free MIPS. It's what I like to call, look mom, no hands, or no click for MIPS. Now with the quality measures, you just pick 6. You provide and document the care, and Uprise will track and report for you. On improvement activities, just pick 1 or 2, and Uprise is going to track and report. With advancing care, you can do nothing, or you can do some for extra credit. These are things like e-prescribing, patient-specific education, summary of care, and secure messaging. And the view, download, and transmit are the patient portal activities. With cost, again, you do nothing, and it's calculated automatically by CMS. Now, Uprise supports these categories with EHR reporting, so no more PQRS codes on the claims, no more click for MIPS, and the data is uploaded from the EHR automatically. Just run the reports and upload. With Uprise, there's no reason to simply avoid the penalty. Just use it and wait for the bonus money. Let's look at some quality measures, starting with glaucoma, to see how hands-free MIPS works. Now with primary open-angle glaucoma, we have to do detailed disc evaluations, and most EHRs have many ways to document the detailed disc evaluation, but only one way to qualify for Mips, and it's usually additional extra clicks. With Uprise, you just simply document any way that you can do it, and no extra clicks are involved. So if you do any one of the following, just do and document a cup to disc ratio. If you do and document 92225 or 6 extended ophthalmoscopy, fundus photos at 92250, or OCT of the nerve 92133, an OptiMap screening, retinal screening, or select any item in physical exam with glaucoma, and it's going to trigger the numerator. And Smart Touch even automates the CPT codes. And the interpretation report is even done automatically. So Uprise automatically adds the numerator and tracks and reports for you. Now with age-related macular degeneration, we have to do dilated macula exams. So all you have to do here is simply dilate the patient. Uprise triggers the numerator, records and tracks behind the scene. Again, look mom, no hands, hands-free Mips. Now diabetics, we have to do retinal exams. With Uprise EHR, just do any of the following. Select dilation, do any retina exam, do and record extended ophthalmoscopy in 92225 or 6, fundus photos, an OCT of the retina, OptiMap screening, or retinal screening. Any of these things will trigger the numerator, and Uprise tracks behind the scenes. Again, no clicks for Mips. And you'll be able to just go to and check out the score on the Mips tab. Now, with diabetic retinopathy communication, all you have to do is select the ICD code in physical exam, and then select the automated clinical summary or clinical continuity of care document or a patient communication letter. Any of those things, Uprise will trigger the numerators and takes care of the reporting for you. Now, diabetic retinopathy, you might remember we have to also document whether there's any macular edema and the severity of the retinopathy. So here, all you have to do is select the diabetic retinopathy code from physical exam and dilate the patient. Then you close the exam and go home. Uprise does the rest. Now with medications, blood pressure, BMI, and tobacco use, just have your technicians record the findings in the normal workflow. And that's it. Nothing else to do except sit back and count the dollars you're going to see in 2020. So hands-free MIP can take the pain out of Mips compliance, and it's no clips for Mips with Uprise. It's easy and automated. Just provide the care in your normal workflow, close the exam and go home. Uprise does the rest. And Uprise is all you're going to need. So to summarize with Mips for 2018, this is all you really need to know. This one slide. This is the money slide. I presented information today from the CMS QPP Final Rules fact sheet and their website. I have the link here for those that want a little late night reading. And again, the QPP measures for our care will be on a score of 0 or 100, just like optometry or medical school. And if you have a score of 15, there's no penalty. This is a no-brainer. Just use any good 2014 or even 2015 certified EHRT. Now 70 points are going to get you the additional bonus, and this is easy to do with Uprise hands-free Mips. Now, small practices, for instance, doing $100,000 will bonus $5,000 in 2020, increasing to $10,000 in 2022. So that's not small change for small practices. Now, with quality measures, it's 50%, and you pick 6 measures, and 60% of all the patients with the condition need to be reported. They're the denominators, and doing the care will trigger the numerators, and the numerators and denominators are going to be benchmarked and graded against our peers. Now, improvement activities is 15%, and you just pick 1 or 2 measures. With advancing care, it's 25%, and here we don't have to do a darn thing. But if you want to submit anything else, you're going to be able to get additional credit. Now, cost again is 10% of your score, and you don't have to do a darn thing. It's calculated automatically for you. So, why join the Uprising? I hope you can see now the benefits of Mips for your practice. I also think you'll agree having a true cloud-based EHR that automates Mips will give your practice an advantage. And I've found that if I can focus on the patient and not the EHR, Mips really can improve care for my patients and provide additional incentives for my practice. Uprise is critical for my practice moving forward with Mips implementation. And Uprise allows me to simply provide and document the care as I normally would, and it does the rest without any additional clicks. I just close the exam and go home. And you may have heard me say before, all I ever wanted in practice is an unfair advantage. Uprise EHR's hands-free Mips gives me an unfair advantage, and I think it can do the same for you. So let's review the benefits of Mips one last time. Medicare Part B reimbursements can be adjusted up or down 9% in 2022, again an 18% swing, and practices doing only $100,000 a year in Medicare can mean $9,000 a year. Professional reputation. The Mips score will be posted on the CMS Physician Compare website, and it can enhance your professional reputation and give you an unfair advantage. And I'm certainly going to be posting a link to the CMS website on my website to track new patients when the Mips scores are released. Practice value. Again, modification of future earnings will directly affect current practice value related to potential mergers and acquisitions, and there's certainly a lot of that going on in ophthalmology and optometry today. In provider compensation, again, Mips eligible clinicians will have a greater value to the practice based on Mips scores. And again, loan ratios will make it easier to acquire and maintain loans based on the debt service ratios. And that's it for the Mips update. I hope you and your practice benefits from today's presentation. More importantly, I hope it helps you decide if Uprise EHR is a good fit for your practice. Feel free to contact me at my email address listed here, and I can send you a PowerPoint presentation if you'd like. You can review it at your own discretion. I'm happy to help, and I hope you join the Uprising. Thanks for watching. See you in the cloud.